I am Dr. Dushyanth Kalva. I am a plastic and cosmetic surgeon at Inform Cosmetic Surgery, Hyderabad. Today, we are doing a secondary hair transplant on this particular patient. By secondary hair transplant, we mean that he had already got a hair transplant elsewhere, but the results were suboptimal. I am going to explain to you what exactly is his problem today and why it is so important to have a very planned and meticulously done procedure. We are starting with the frontal hairline at the corners. The central part of the frontal hairline has already been corrected. So since he has got a hair removal done, so we are planning to correct by drawing a new hairline. So the frontal hairline should never slant downwards. If you can see, there is a telltale sign of the old hairline which was done previously. So it should never slant downwards, but it should curve upwards or at least be parallel to the horizontal line. Then if we have to bring forward his sideburns, so we are going to do a hair transplant to fill up this area. And mind you, this is not just about the frontal line drawings, the direction of hair is important as well. So it is very important to choose the right direction of hair, right kind of follicles, whether it's a 2-hair follicle, 3-hair follicle, or is it a single hair follicles, the right kind of distribution, the right direction, the right density and the right shape. So these are all the parameters that one should take care of when doing a hair transplant, especially to frontal region, because it is what makes or breaks a face. So we are drawing the other side. So we make sure both sides are nearly symmetrical. So not only the correction of these corners, we are also trying to improve the density in this area, as well as he has lost density. We are doing an addition to the existing hair over here as well. So we are going to mark up the area that has got less density to do a fill-in grafts. So we not only go by the objective assessment of the patient, but we also go by the patient's priorities as well. For this patient, the priority is these corners and the crown area which is thinning. So his request was to correct these and then fill in, and if possible increase the density in this visible area as well. So priority is number 1, number 2 and number 3 today. If we happen to get more follicles, we might as well fill in a little bit of this area. Now when we are doing a filling grafts, we have to be very careful not to damage the existing hair. So this is going to be a high density transplant, and this is going to be a little low density transplant where we search for space between the existing hair follicles and then do a fill-in grafting. So now that we are done with the marking, the next step is we proceed for trimming of the entire area, and we choose, since his donor area, which is the back of the head, has already been used, so we try to choose an area that can yield us with maximum number of grafts without actually damaging the donor area. So for that we will trim and give him a wash, and then we will proceed with the blocks for extraction. We have finished prepping the patient and he is on the table in the required position. So now I am proceeding with the block. These blocks ensure that the patient is completely pain free during the duration of the procedure. That is, for now it will be the extraction. This local anesthetic blocks the nerves that supply the area where we are taking the hair from. That is the occipital nerves, the greater and lesser auricular nerves, etc. So these are level 1 blocks, very simple to give. The patient also tolerates them very well usually, and the rest of the procedure is comfortable. For this patient, this donor area has already been used for the previous procedures. So now we will be concentrating on both sides for extraction of the grafts. And this is the equipment that we are going to use for extraction. This is a HARRTS mini robot. that has got certain autonomous functions to allow us to extract very high quality grafts with very less wastage and damage. This is 6 hours later after I was done with the marking. So we are finally done with the procedure. We have done about 1000 grafts to the frontal hairline and to the corners, and 1000 grafts to the crown area. If you see, the hairline has been, a nice wavy hairline has been done, yeah, which is ending sharply with the side lock. The previous hairline was this way, very unnatural, and he had to remove all the hair. Now all our hair is transplanted this way, and even the direction of the hair is pretty much natural. So when his hair grows back after a few months, so he will have a very natural looking hairline with a very natural hair direction as well, and with very good density. And this is the donor area where we have taken the grafts from this time from both the sides. And thus this ends our hair transplant for this patient. Now he will be put in a dressing which will be removed, and then he will be left open from tomorrow onwards.